Dr. Albert. I'm a Senior Associate and Lead General Practitioner for the Allergy Clinic at Springs Medical. If you suffer from hay fever symptoms like constant sneezing, nasal congestion, runny nose, itchy eyes, itchy throat, then this clinic may be the right thing for you. Allergies can be caused by inert substances like grass pollen or dust mite, and it causes an exaggerated reaction to your immune system to cause these symptoms. The Allergy Clinic will determine whether desensitization is the right therapy for you to treat these allergens. Desensitization is a method where we make your immune system not overreact to these inert substances and thereby decreasing your symptoms. We do this via 3 visits to our Allergy Clinic. The first is a prolonged consultation, the second is a skin prick test, and the third is a telehealth consult between us and the allergy specialist. Allergy Visit 1 is a prolonged consultation which takes about 40 minutes. In the consultation, we will determine factors that may or may not be related to your allergy presentation. Some other issues may be uncovered during this interview, like for instance if you have active asthma. This will need to be treated before we proceed to the skin prick testing. Some people may also be discovered that they need other forms of treatment rather than allergy treatment, and we'll be happy to refer you on to someone else should that be required. Visit number 2 is the testing day. Normally this is done in 2 parts, a lung function test and a skin prick testing. Due to the COVID situation, however, we are no longer doing the lung function test and it will be deferred until further notice. So please bring along any puffers you may have as a precaution on the day of testing. 2 days before the testing, please remember not to take any antihistamines or steroid tablets, as this may affect the results of the test. When you come in for the test, we have a single device which we apply to your arm. This tests 8 to 10 substances at a time, and any positive test will result you going forward to the 3rd allergy visitation with our visiting specialist on telehealth, an allergist based in Melbourne. This is the device that we'll be using, and we will put it on your forearm in 1 hit. Once you've had your skin test, you will then be booked for a telehealth visit with our specialist in Melbourne to determine the right therapy for you.
So tell me, Corinne, what are the symptoms that bother you as you experience them? It would help me to know and understand what they're like for you.
The Allergy Clinic is a specialised collaborative clinic between your GP and a specialist allergist based in Melbourne. So there is a cost to the first 2 visitations to recuperate the cost of testing. All subsequent visits, including the initial desensitization sessions, are bulk billed. Currently, the PBS doesn't subsidize the cost of the treatment. So if you require any further information about the cost or the Allergy Clinic, please make an appointment with your regular GP at Springs Medical for further information. Thank you for looking at and listening to this video. Please stay safe in the COVID environment.